team. We have a patient presenting with trichinitis, bronchiolitis, and Ehlers disease. Let's diagnose this.
It could be a severe respiratory infection causing these symptoms.
I'm thinking it might be a rare autoimmune disorder given the combination of these conditions.
Maybe it's a viral infection affecting multiple organ systems.
I believe it's a genetic disorder leading to these symptoms.
You're all wrong. It's osteochondritis dissecans.
What? That doesn't match the symptoms at all?
Are you sure, Hawks?
That seems unlikely.
I've never seen osteochondritis dissecans present with these symptoms before.
This is risky, Hawks. Are you sure about this diagnosis?
I don't want to hear it. I'm the doctor here. We must perform a hysterectomy on the patient, and that's final. Tracy, I need to perform a hysterectomy on my patient. I'm almost certain they have osteochondritis dissecans.
So why do you need to perform a hysterectomy?
Did you completely ignore the second thing I said regarding osteochondritis dissecans?
No, that's why I'm asking. How is a hysterectomy supposed to help a joint disorder?
Because I'm the doctor and I said so.
Well, would you look at that? Hysterectomy was not the right treatment for osteochondritis dissecans.
And the patient is for some reason in critical conditions. I guess removing the history will do that.
Remove the history. What are you talking about, Gary?
I removed the patient's records from our system.
So the patient is in critical condition for an unrelated reason, and we have no clue why?
Probably. We could find out if we still had the patient's records.
I don't have anything in response to that. I'm starting to get sick of working at this stupid hospital with stupid doctors. Several years of experience, hard work, long hours, sweat, blood, and tears culminates in me ending up at the worst goddamn hospital I've ever worked at.
I've worked at far worse.
Talk to the hand.
The one we worked in a few months ago looked like a pixelated, blocky video game. Absolutely lazy architecture.
Talk to the hand.
I hand. Well, you just turned into middle finger. What's up?
You imbeciles nearly killed our patient. Osteochondritis dissecans was a misdiagnosis, and a hysterectomy was the wrong treatment.
We don't even know what nearly killed our patient. Gary removed the patient's medical records and we can't find them.
Don't even bother looking for them. Thanks to laws we have in place, I protected the patient's privacy by incinerating their records, then shipped the ashes in an urn to Antarctica. We must comply with the law.
Don't even look at me right now. The patient is dying purely because of you.
If it's any consolation, they were never operated on and only went into critical condition before we were scheduled to do anything.
That's not any consolation, Frank. That's an invitation to a mystery no one asked for.
Don't worry, Hawks. We'll solve this mystery faster than you can say Gary Snacks.
We have nothing to work with. No history. A patient is dying for no known reason. We're screwed.
At this point, we'll end up finding out what's wrong with them post-mortem.
It's not entirely hopeless. We will continue investigating this. Gary, just keep your ass glued to that couch in the meantime. Hawks, relieve stress at lunch.
That's a great idea. If it helps, the correct diagnosis is probably endometriosis.
Based on the symptoms we saw earlier, I doubt that.
Then prove me wrong and investigate it now. I can't stop thinking about this one patient of mine, Johnson. It's like all the pieces of the puzzle just won't fit together.
I understand, Hawks. It can be frustrating when a case doesn't seem to make sense. Have you tried consulting with other specialists?
Yeah, I've reached out to a few colleagues, but no one seems to have a clear answer. Meanwhile, how are things going in oncology?
The oncology department is pretty busy, but we're managing well. My patients are responding positively to treatment, so that's a good sign.
That's great to hear. You know what? I think I've just had a breakthrough with my patient. It all makes sense now.
Really? That's fantastic news, Hawks. What was the diagnosis?
I'll have to go check on my patient right away. Sorry, gotta run. Catch you later, Johnson.
Wait, Hawks. At least tell me what you found out.
No, because if there are spies in this hospital facing similar issues, I cannot afford anyone copying my style. We have trade secrets for a reason.
You're talking about health, for Christ's sake. Whatever.
I have an important update. Everyone.
What's going on, Hawks? Why aren't you wearing proper protective gear in the operating room?
Yeah, that's completely unacceptable.
Those details are irrelevant now. I have made a groundbreaking discovery about osteochondritis dissecans.
Put your clothes on, asswipe. You're endangering the patient.
Team, You are endangering the patient by letting this idiot back in the OR.
The patient did nothing wrong.
He's talking about me, stupid.
I have re-diagnosed it as a case of genetic alliance, okay?
Genetic alliance, UK? But what's the prognosis for that?
The prognosis is simple. We treat it with genetic testing, and the cure lies within the research of Dr. Johnson.
This is unbelievable. How did you even come to this conclusion?
Dr. Johnson has some friends in Genetic Alliance, UK. The patient is British, therefore they're the United Kingdom's problem now. I'll prep their flight plan.
That's brilliant. So, because you don't know what the problem is, we're just shipping a patient off who's still in critical condition overseas. Why not just send an email requesting records from the hospitals the patient attended in the UK?
When you put it that way, I guess that's easier, and far cheaper, and less climactic. I must say, Tracy, I'm glad we got to the bottom of the correct diagnosis for the patient. Email was the missing piece.
Yes, well done, Hawks. It's important to admit when we make mistakes and learn from them.
Agreed, but these medical mishaps wouldn't happen if I didn't have such incompetent doctors on my team.
Hold on a second, Hawks. You were the one who made the initial incorrect diagnosis, not your team.
Gary literally deleted our patient's records from our hospital's database, and the patient went into critical condition with an unknown cause.
And it didn't occur to you for several hours that you could have placed a ticket with the IT department to check for database backups.
They don't like me very much.
That's irrelevant. You wasted so much time by plausible deniability of technical ignorance. I'm not stupid, Hawks. You just hoped we would finally fire Gary over something easy to fix.
I don't have anything to say to that.
When you do, feel free to email me.
Shh.